Hey everyone, welcome to KSSP Podcast. I'm Spencer.
And I'm Katie. Today we're going to be talking about healthcare, aka some Medicare for All stuff. Yeah, so I'm going to just start with my personal opinions here. Saying that medical services aren't a human right is to say that the disabled don't have a right to their life. And not to mention, medical treatment tends to be much cheaper when it's preventative than when it is an emergency. Full coverage of medical care includes not only your baseline healthcare needs, but also vision plans, dental plans, family planning methods, any specialists needed, and a lot more than that. Full coverage means that if you have any issues with your body that you cannot or should not solve on your own, you need to go see a doctor, dentist, or whichever specialist is necessary. And we shouldn't live in a world where you literally need to pay to play, aka you need to make payments in order to survive as a human being, especially not in the wealthiest nation on earth. Like, we're America. That is just ridiculous that, we have the most money in the world and we have people who are dying because they can't pay for their health care. Like, that just, that bothers me.
Yeah.
So, yeah. According to Commonwealth Fund, they say 43% of working age adults were inadequately insured in 2022. These individuals were 9% uninsured, had a gap in coverage over the past year at 11%, or they were insured all year but were underinsured, meaning that their coverage didn't provide them with affordable access to health care. And that is 23% of the population. And then we have an article next. This is how Medicare for All saves the U.S. money. So, new study says Medicare for All will save the U.S. money with lower healthcare costs. A single-payer healthcare system would save money over time and likely even during the first year, according to a review of 22 analyses of both national and state single-payer proposals made over the past 30 years, according to a study published Wednesday in PLOS Medicine. So, it just says switching to a single payer system, the study suggests could save the U.S. more than $600 billion. That's crazy.
It's a lot of money.
It is. I mean, I don't know why we wouldn't do that. But
Yeah.
yeah, the study is the first of its kind that reviewed analyses of single payer proposals and provides strong evidence that Medicare for All would be financially affordable for the U.S., said the study's first author, Christopher Kai, third-year medical student at University of California, San Francisco, which is a medical school, in an interview with Fierce Healthcare. So to study the consequences of what would happen if the U.S. adopted a single-payer system, UCSF, UC Los Angeles, I'm assuming, and UC Berkeley examined 22 economic analyses by government, business, and academic organizations of national and state level single-payer health plans, including proposals made in Massachusetts, California, Maryland, Vermont, Minnesota, Pennsylvania, New York, and Oregon. So these analyses were used by policymakers to evaluate the proposal, estimating savings the plan would create through simplified billing and lower drug costs, while also taking into account increases in health spending that would arise as newly insured people sought health care. 19 studies showed the U.S. would save money the first year of adoption, averaging 3.5% of total healthcare spending, and all the studies show healthcare savings in the long term. The greatest source of savings comes from reduced administrative costs, with further savings from lower drug costs, the study found. And the models were created by analysts from different political perspectives, and they provided a range of cost estimates in the first year operation from 7% higher to 15% lower. So long-term savings from simplified payment administration and reductions in drug prices and other efficiencies range from 3 to 27%. The largest savings found in plans that lower drug costs. Actual costs and savings will depend on features and implementation under a specific proposal. So under proposed single-payer plans, such as Medicare for All, a unified public financing system would replace private insurance, similar to healthcare system of Canada and many other wealthy countries. So The study showed that compared U.S. administrative healthcare costs with that of neighboring Canada indicated the U.S. would save $600 billion in costs by switching to a single-payer system. It's generated discussion in 7 Democratic presidential debates. Bernie Sanders and Elizabeth Warren both support Medicare for All proposals, while some other candidates favor building on the Affordable Care Act. It's always our hope that elected officials will spread accurate information. If you watched the Democratic presidential debate last night, a lot of people were referencing that Medicare for All will cost more and we can't afford it. In light of this evidence, I think that's simply not true, said Kai, who disclosed as part of the study that he is an executive board member of Students for a National Health Program, a group that supports a single-payer system. Obviously, I have personal opinions about healthcare reform, adding that the study included a broad group of authors from both sides of the debate who all made disclosures of any potential effects. The studies underwent a peer review process. So studies authored by those with liberal leanings are more likely to show more generous savings, but analyses supported by more conservative funders or performed outside of academia still predicted single-payer systems would yield savings. So they all basically said that there would be savings. So the Nonpartisan Congressional Budget Office said in a report last year, total spending under a single-payer system might be higher or lower than under the current system, depending on key features of a new system, such as payment rates for hospitals and doctors and whether patients would pay part of the cost of care. Even though they start with different single designs and modeling assumptions, the vast majority of these studies all came to the same conclusion, said study author James Kahn, a professor in the UCSF Department of Epidemiology and Biostatistics and a member at the Philip R. Lee Health Policy Institute. This suggests that fears that a single-payer system would increase costs are likely misplaced. Higher initial costs were associated with plans that had low copays or none at all, offered rich benefits, or that did not expect savings from lower drug and medical equipment costs, the study found. So that's that article. And then we've got another article here from Hopbrook Institute. Economists conclude that Medicare for All could be considerably less expensive than the current. Well, anyways, I assume I was going to say the current healthcare system or something.
That's what I would assume, but...
All right. Great start. Well, we are economists interested in public policy and healthcare. Some of us had worked to estimate the cost of alternative healthcare programs. Others have reviewed such estimates. We believe the available research supports the conclusion that a program of M4A, Medicare for All, could be considerably less expensive than the current system, reducing waste and profiteering inherent in the current system, and can be financed in a way to ensure significant financial savings for the vast majority of American households. Of course, the details would depend on the design of the M4A system. So compared to the current system, M4A would achieve considerable savings on administration and by reducing payments to monopoly drug companies and hospital networks. Within a few years of operation, M4A could save hundreds of billions of dollars per year from these sources. Additional savings will come when rational healthcare finance system allows needed investments in coordinated care and preventative care, as well as reductions in fraudulent billing. Over time, global budgeting would slow the rate of future healthcare costs significantly, as has been done in Canada and other countries. Bending the cost curve could save more than $2 trillion over the next decade, and even more with a well-designed system. Costs would be predictable, enabling households and businesses to plan in a way that is impossible today. There are added costs associated with M4A, universal coverage and increased utilization. Coming from reduction or elimination of cost sharing will add costs, but studies show that these added costs will be far less than the savings outlined above. And then the need for increased public funds replacing premiums can be financed with some combination of payroll, income, and wealth taxes. By eliminating insurance premiums and out-of-pocket expenses and lowering overall healthcare costs, M4A will result in enormous savings for almost all households, all except the richest households who will pay more in taxes. Shifting the burden from person, which, I think the rich can afford to pay those taxes, just saying. Anyways, shifting the burden from per person payment for premiums and cost sharing to income and wealth related taxation will magnify the savings for most households. The current system is particularly burdensome for middle income working households who receive relatively little support through Medicaid or other public programs, but are responsible for health insurance premiums either paid directly or by their employer as non-wage compensation. A system that cuts costs and shifts financing to income and wealth taxes will dramatically lower this burden, producing significant savings for workers and businesses. The net financial savings will be accompanied by substantial improvements in productivity through improved health and the elimination of job loss coming from the need to stay on a job to retain health coverage. Most importantly, M4A will reduce morbidity and save tens of thousands of lives each year. True. All right. Did you have any input?
Not too much. I think it's just clearly obvious that a system like Medicare for All or a single payer system would reduce costs and help everyone. Like it's odd to me that people don't, either they choose not to believe that or they just don't care. I mean, there could be some propaganda behind it from health insurance companies who obviously don't want something like that because that would get rid of them in a sense. Right. I mean, some systems still have a form of private and government. Like I think
that's how it is
in Europe. Is that how it is in Canada too?
I think so.
And especially for like elective procedures, like those are still, I think, more covered. Like you have to pay for those or have private insurance to cover those. But I think even in other countries like Europe, if I remember correctly, you can choose to still opt for private insurance.
Yeah.
So it's not like we would necessarily even have to fully get rid of private insurance, but everybody should have health insurance regardless of if they have a job or not.
Right.
We should all have basic access to health care.
Yep, 100%. All right. We have this PragerU video. What's wrong with government-run healthcare? Well, let's see what Mr. Prager's got to say about this.
It's very easy for a politician to stand up before voters and say healthcare is a right, and then passionately advocate for single payer or free healthcare or Medicare for all, whatever term they might use. But before we consider the merits of the government managing your healthcare, and that's what this all boils down to, maybe we should ask a more basic question. What do we mean by healthcare?
Oh, no.
Because if you get sick, and here we're talking major illness or you're in serious pain, you don't just want healthcare. You want quality healthcare. And where is your best chance?
I mean, look, I'd rather have really bad healthcare than no healthcare at all. So, just saying.
But is he with that? That to me sounds like they're claiming that to have quality healthcare, not everyone can have access to that healthcare.
Yeah. Well, they're claiming that, I think they're about to claim that the government cannot manage quality healthcare.
Oh,
I think that's what they're trying. I mean, there's already government-run hospitals. You know,
yeah.
It's not like that doesn't exist in America, because it does. But, and I mean, they're not terrible hospitals. You know, I've been to some.
Yeah, I guess it depends.
And like clinics and stuff, like
where, like what they are, but there's also like politicians, I'm pretty sure, get government healthcare and
that's like premium
hospitals
and this is more about I want my right to better healthcare than everyone else, rather than working towards everyone getting that good quality healthcare.
That's obviously my start of concerns with this video, is that it just seems like they think that if we give healthcare to everyone, it's not going to be quality anymore. But in my opinion, we either all deserve quality healthcare or we all or no one. Like nobody deserves something that others don't. We all, like,
nobody should even have healthcare if you don't believe in that. You know, like if you don't believe everyone should have it, we should just eliminate healthcare completely and see how that goes.
That'd save us a bunch of money too if that's what they're concerned about.
Yeah.
I mean, it.
And then if you get an infection in your arm, like you basically just got to cut it off or you die. You know, like back in the day.
Actually, that would probably destroy productivity in America because everyone would get
Oh,
sick
it
and die.
absolutely would.
But they wouldn't be paying a health insurance premium
Yeah, you wouldn't
anymore.
have to pay for someone else's health insurance at least. Look, you're already paying for other people's health insurance. Medicaid and Medicare exist. Like, it's not like you're not already paying for other people's health insurance through your taxes. Like, it is happening already. So why would you not just extend that to everybody who need, or like everybody in general?
Yeah,
Because then it's more fair, you know?
and I just
And
don't.
it's just the right thing to do. Like, I don't understand how you could not just
Yeah,
like get nauseous thinking about all the people who die because they don't have health care.
it's sad.
And like people have to ration out their insulin and stuff like that because they're underinsured or maybe not even insured at all.
And I would say part of it comes down to more propaganda about how people who aren't insured or can't get insured are lazy, and that's wrong.
Yeah.
It's building an us versus them mentality, and that
Yeah.
is terrible. We need to get away from that. We are all Americans. We are all deserving of quality healthcare. I would argue too. Everyone is deserving of quality healthcare.
Yeah. Yes, definitely. But yeah, let's see where he goes with this. Well, let's see what angle he's going to take here.
Chance of finding that? The answer is right here in America. For skilled doctors, cutting-edge medical treatments, and care without long delays, no other country rivals the United States.
He's saying the U.S. has the best healthcare. Okay, there we go. Like, currently has the best healthcare system.
That's very wrong.
Right, that's a very misinformed opinion, but all right.
Yes.
Go off, King.
Not even close. Nobody from Texas is going to Canada for medical treatment. It's almost always the other way around. Sure, our healthcare system has lots of issues, and we should address them. But do we really want to upend all the advantages that we do have and start from scratch? Because that's what would have to happen if we completely turn healthcare over to the government. So let's imagine we make the change. We hear a lot about how great free healthcare would be, but it's only fair we look at the downside. The first is that government-run healthcare takes medical decisions away from patients. That means you.
How?
Yeah.
Like, no, it doesn't.
What is it?
Like, first of all, I'm 100% positive PragerU is like anti-abortion, and that is taking away healthcare from people already. So, like, you can't really make that claim at this point.
Well, and what do they
not be contradictory?
I think they believe. I mean, it's probably obvious that they believe in the capitalist system of healthcare. Without capitalist healthcare, we're not gonna have innovation, leading to you won't have the technology to get care. But that is just,
and that technology is only for the rich.
Yeah, and
like,
we
people
could.
Who have Medicaid aren't getting that kind of healthcare.
But they could. It's all
they could.
A farce. It's fake.
If everything was centralized and it was run properly, then yes, they could.
And we can afford it.
Yeah, we have plenty of money to afford it without even raising anyone's taxes.
Mm-hmm.
But
that means you, and puts them in the hands of bureaucrats.
Oh my God.
They decide, for example, how many MRI machines are going to be available, or under what conditions you can get back surgery or a bypass, or
I mean, aren't there already like medical practices that determine this? Like, I don't
Health
see
insurance companies will determine whether or not they think
that's true
that your the MRI was like health insurance companies are the worst.
Well, and they'll say, we're not going to cover this because it's not necessary, even when it's like completely necessary to your survival. Like, they'll just say, no, not necessary. This is out of your pocket now. And that gets expensive for anyone, really.
Do you know how many doctors I've heard that have to fight insurance to make sure that they cover this for the patient? It's ridiculous.
Like, I've had to have multiple doctors send letters to my insurance companies explaining why I need what they're trying to prescribe me. Like, it's ridiculous. And that's just my own personal experience, you know. I'm sure plenty of other people have had that happen too.
Yeah.
Even whether you qualify for cancer treatment. That's how it works in the United Kingdom under its single-payer system. Because it has finite resources, the National Health Service, or NHS, sharply restricts access to treatments like hip and knee replacements, cataract surgery, and even prescription drugs to deal with common conditions like arthritis and diabetes.
This literally already freaking happens.
But also, my thing is why does the argument always go to these problems in these countries with social? Why do we have to copy them verbatim?
Right. We're not
Can
gonna
we not come up with our own system?
Yeah, do you like not believe that America is the greatest country in the world? Like they can, you know, like they can get through anything and they can figure out new solutions and innovate things.
Yes, we can take things that worked for them and then make it our own. We don't have to copy the playbook that they are following. We can make our own.
And we can even look at these other countries and see what they are doing wrong and then not do that.
Exactly.
Like, you know?
So this is also just, it's irrelevant because we don't have, like, whenever they bring up another country and they're like, well, look at what's happening wrong in this country. It's like, okay, then we won't do that.
Right.
But that doesn't negate the benefits of a single payer healthcare system, because we can run it our way. We don't have to run it someone else's way.
Yeah. For sure.
If you suffer from any of these ailments and many others in the UK, you may just have to live with the pain.
That's not true. Like, you still get access to healthcare there.
Yeah.
And you don't have to pay for it. Like, you pay through your taxes, but you don't have to, like, pay out of pocket for anything.
Yeah, and I guess I don't fully know their system either. I'm not gonna...
Yeah.
Like,
yeah. I just know I've seen interviews with them and stuff, with, like, people in the UK, and they've said, like, it's crazy that you have to pay for anything in your healthcare system because we don't have to do that.
Oh, okay.
That's just where I'm getting my information from, I guess.
Yeah,
I mean, I suppose all these people could be lying on the street, but like I kind of doubt it.
Yeah, I don't think America would try to put because you saw it in them, like on YouTube, I'm guessing, or
yeah, I just saw like a YouTube video or something where like they're interviewing people about our healthcare system, but like people in the UK and what they thought of it.
Yeah, I'd highly doubt they would be paid actors or whatever,
I don't think,
but they could have been, I guess.
Like, they don't have to pay for anything.
Although I don't know why some people would think we were trying to push propaganda on about the benefits of a single health care system, because you don't have to propaganda it. There's just
it's not
proven benefits already that you can physically see. You don't have to make up fake propaganda like you do to convince people that it's bad. You know?
Right, like, because it's not propaganda when it's like actually the correct information.
Yes.
Like, it's just information at that point. But like, people like to ignore reality.
Well, yeah.
And then the same people say, oh, like, facts don't care about your feelings. And then they go off to say things that are not factually true and then base their entire beliefs around those things.
And then they get fuming when you bring up the facts. And it's like, I thought feelings, I thought they didn't care about feelings.
About your feelings.
Yeah, so why are you getting mad? It doesn't matter. They don't care.
Right, exactly.
And let's hope you don't have a medical emergency. In a January 2018 article in the New York Times, patients in emergency rooms around London are described as having to wait 12 hours before they are tended to.
You know how we solve this problem, though? You pay people to go to medical school. And you pay people to go to nursing school. That's how you get more healthcare staff. Like, I don't understand how that would not be the solution to the problem.
Yeah, it's very odd that their solution is...
Like, their solution is, just deal with it. And, keep it like the current system, but just single payer. Like, no, we can change things about the system, too.
I think their solution is we keep the system how we have it in America, because then people can't afford healthcare, so that keeps the wait times long because people are dying in the street instead of seeking healthcare.
Right. And
So
then
that's why our wait times are shorter. And they're not even shorter.
they're not even that much. I mean, I've
No.
never waited 12 hours, but I have waited like 6 to 8 hours in a waiting room before in America. So,
Yeah, and they
it's not
still
like it's so much better.
triage. Like triage is a thing. So
Yeah.
they're going, like, even I'm assuming in other countries they also triage. So if somebody comes in with a heart attack versus someone with a broken foot,
Like
what
they'll
do you
take
think they're gonna take? Like
exactly.
so, and we don't even know any of the facts behind this supposed maybe he's gonna elaborate, but all we know right now is waited 12 hours before they're attended to. Okay, and that happens.
Yeah, and at least they got the health care still instead of dying in the street.
Yeah,
Like,
and
I'd rather wait 12 hours in a waiting room than just die in the street, you know?
Definitely. And I highly doubt it was a stroke or a heart attack or
Right. If it
a
was something
medical
that needed
emergency.
immediate,
it might be.
yeah,
We'll
if it was
find out,
something that
hopefully.
needed immediate attention, then like they definitely would have taken them in first and not waited 12 hours. But
Yeah.
we'll see what he has to say. Yeah.
Corridors are jammed with beds carrying the frail and elderly. To deal with the situation, hospitals were ordered to postpone non-urgent surgeries until the end of the month. That hardly
Okay.
seems like an improvement over what
We had
have
to do that during COVID.
Yeah,
Literally.
and I mean that happens anyways. Like
Yeah.
people have to wait to get surgeries that aren't like
Emergent.
essential anyway, like emergencies anyways. Yeah.
And he didn't even tell us what the supposed a medical emergency was that they had to wait 12 hours for. So that's
right. I mean,
I'm
it
pretty
could have
sure
been like me where like I stubbed my foot and my toenail came off, you know, like that's not a huge emergency and I can wait 12 hours in a waiting room to deal with that and be fine.
And I mean, it could have been something where they had an ulcer and obviously you want to get to the hospital so that if they need to start antibiotics or something to prevent sepsis. So there are definitely things that can turn into emergencies.
Right.
But if it was an emergency that needed to be treated as soon as possible, we do that. We don't make them wait. Although I agree with you, if we made education, I think all education should be free, but definitely nursing and doctors, that's the issue. I don't know why I get why they think
it shouldn't even just be free like for nurses and doctors. They should literally pay them to go to school because we need them that essentially. And we need to put more, and then we would need to put more funding into bigger hospitals or more hospitals, however they want to do it, I guess. Like, so that, you know, the waiting times aren't long and that everybody does have a room that needs one in case something like COVID happens again, for example. You know, like COVID 25 or whatever it's going to be next, you know.
Yeah, but they act like the problem is people having access to healthcare when the problem is that we don't have enough doctors and nurses to take care of these patients.
Right.
It's not a problem with how many people can access healthcare because everybody deserves access to healthcare. The problem is the staffing.
Yeah.
And when I was a nurse, it's not just staffing. There's like a lot of, I would say, like psychosocial, mental, physical. There's a lot of nursing is not easy. I will say medical field is not easy just in general. But either way, more staff would have helped because then you'd have lower patient ratios and more doctors so that they also have lower patient ratios so they can be more at the bedside more often. So there's things, I think more staff is going to help a lot of the issues that we have, not keeping it what is it called right now? Health insurance payer system. A single payer system is not going to make, I mean, you may think it would make things worse because everyone would have access to healthcare, but that is because no one deserves to be dying on the street because they can't afford healthcare. That is wrong.
Yes.
Exactly. That is not a developed country
they don't
at
care
all.
Because as long as the rich get their super special treatment, like they're happy. They don't really care if you die because, you know, the rich are still benefiting. And that's what this is really all about, you know, because the rich do get a lot better health care in America than other places. But that's because in a capitalist system, of course, the rich are going to be prioritized in every aspect of life because everything involves having money. And especially in a capitalist system, like anything you do, like you need money, even just to live. So
then I'd argue we don't live in a developed society, a developed country.
I mean, I like to call America a second world country sometimes. Because, like, we're not quite in the first world. We're a little, but we're not completely a developing nation either. We're, like, somewhere in the middle. So I say second world country.
I don't know all the differences between those, but we're definitely not developed.
Yeah. No, not complete.
I'd say we're developing, but we're not, because we're not working toward. They're working against developing.
Like, we act like we're a developing country when we're the wealthiest country in the world. Like, it's ridiculous. But anyways.
A second big problem with single-payer systems is that they are expensive, really expensive. A recent study by the Mercatus Center at George Mason University found that a Bernie Sanders-style Medicare for All health system would cost a tidy $32.6 trillion over 10 years. Okay. That's on top of what the federal government spends on healthcare today. And this is not a new number. Other studies have found the cost to be roughly...
Wait, are they not going to mention the current number?
They're not going to mention the current number or what happens after 10 years, which would be savings.
Right.
Because that doesn't fit their narrative.
Savings, but they're not even going to mention the current number. That like why not? It's not like it's going to ruin their propaganda to mention that. Like, they just, unless
if
it
it's
will.
a higher number.
If it's a higher number now than 32 trillion, then yeah, I guess that's probably why they didn't show it. If I had to guess.
Yeah.
In the same range. So, how would we pay for it? Kenneth Thorpe, a professor at Emory University and health policy official in the Clinton administration, spells it out. If you are going to go in this direction, Medicare for all, the tax increases are going to be enormous. Not just...
Okay, even if they did increase the taxes, which they wouldn't have to, but if they did, like, you're still going to save money because you're not paying out of pocket for anything, and you're not paying for the insurance. Like, you're paying for the insurance through your taxes. And, like, that will be a lot fair because, you know, the people who are in the, like, a lower income tax bracket, they're still going to get their refund back. You know, so really, but the people who are making a little more money, maybe they have to pay a little bit more, which is fine. That's kind of how taxes work.
Yeah, and I have a little article that talks about average cost of health insurance in 2022 that I'll show. I couldn't find one about, maybe we can look later, about how much they propose they'd have to increase taxes. I was trying to look into that, but maybe we can look then a bit too. But yeah, I will show that it's not, I don't know what their they don't have any statistics, obviously, otherwise they would be showing them if they're claiming that it's going to be more than we pay for health insurance, which is expensive every month times 12. Yeah. So then we would have to see how much they'd estimate we'd have to raise taxes by, and then take that times your year. Like, basically, if tax rates are, I don't know the tax rates in America, but if they're like 12% and they'd have to raise the minimum wage to like 14% tax rate, then we would just have to take that to, like, see how much of a difference that is and compare it to the average cost of health insurance. So there's a way to do it. We just would need to know the numbers.
Yeah.
To actually but why didn't they do that to prove?
And I mean, why do you have to tax everybody? You know, like, why do you have to tax the middle class and the poor to do this? Like, you can just tax the rich, you know? Like, that is an option, even though I know PragerU doesn't like that option. Like, that is an option that would be a lot fairer and more beneficial than taxing the middle class and the poor as well, you know? Like, I don't get why that's inherently what's going to happen in their eyes.
Yeah, I guess I don't know how much the tax would have to be, but
right, and we can go over the article a little later here.
Yeah.
It's for the rich, Thorpe estimates, but for working Americans and the poor too. Charles Blahhouse, the author of the Mercatus study, puts it this way: even a doubling of all projected individual and corporate income taxes would be insufficient to finance these added federal costs. And he considers that a conservative estimate. Canada knows all about exploding healthcare costs. In Ontario, the country's biggest province, those costs took up 46% of its entire budget in 2010. By 2030, that number is projected to be 80%.
Wait, why? What study is this from? I'd love to see it, but they don't have a link. How convenient. Like, they're just putting numbers on a screen at this point. Like, I mean, this could be true. I don't know, maybe. I'm not saying it's completely possible that it's not true, but I would just love to see the source, that's all.
In other words, in a few years, Ontario will have little money to pay for anything except healthcare. Finally, and perhaps most importantly, government-run systems depress the search for new cures. Biomedical research spending in the U.S. far outpaces that of any country with nationalized healthcare.
Why couldn't we just continue to fund that under a single-payer system?
We could. And I also have an article that shows, even because they don't talk about our outcomes though. Like,
Right.
yes, we spend the most money on healthcare,
Oh,
but
we
we
spend the
have
most
the
money.
worst outcomes.
Oh, yeah, absolutely.
So this argument that all this money we wouldn't be able to spend anymore, that doesn't matter, because it
Yeah.
doesn't help our outcomes. And
Right,
that is
and
what
what
is
is-
important when you're talking about healthcare. It doesn't
Yeah.
matter how much research we're doing per se if nothing comes out of that research to actually help people.
Right, because like under the current system, Big Pharma just wants to make their money, and they're not
Mhm.
going to make money off of a cured patient. They're going to make money off a patient who needs treatment. So of course they're going to act like they're looking for, cures, and maybe they are looking for cures, but then they're at such exorbitant prices that insurance isn't going to cover them, and it's just going to be something for rich people with extra insurance.
Yeah, and a lot of it isn't even innovation. All they're doing is trying to figure out how they can make more money.
Yeah.
So
Which should not be the goal of a healthcare system at all. That's pretty terrible.
It's a joke.
It is.
And also, they're saying we can't spend. So basically, I guess I'm trying to understand why granted, we shouldn't be spending this much money because, again, our outcomes aren't improved. We should gauge how much money we need to spend to have improved outcomes and do like cost versus benefit ratio.
Yeah.
But we shouldn't just spend money because we want to. Like, that doesn't make sense to me. But also, I don't see why.
Business deal to me.
Yeah, but I also don't see why having a single payer system would stop us from innovating. Like, why do you think that would stop us from innovating? If anything, that would make us focus on things that will actually work rather than wasting money. Because we will be like, we don't want to spend too much money. So we want to make sure that what we are researching is actually going to be beneficial to the future, not just going to make us money, because money isn't what we're after anymore, if that makes sense.
And honestly, the better our healthcare system is, the better our productivity is. And and like I said, the more you spend on preventative treatment and care, the more you spend on, or not the more you spend, but the more you have access to that, the less emergency healthcare you need. And then that also leads to savings when everybody is covered. Versus, because, if a homeless person goes to the hospital because they're having a heart attack, like, he's not going to pay that bill. Where do you think that money's going to come from? It comes from the government. So it already happens. It's just a lot more expensive right now.
Yeah. And also, I mean, this just goes back to how we could help healthcare in general, is healthcare deserts, where people who live in rural areas don't even have adequate healthcare. So that's another issue that needs to be addressed too. But I mean, I just thought of that now, so I just mentioned it. But
for sure, I agree with that completely.
Even when you account for differences in population or size of economies. That's one reason medical breakthroughs rarely come from countries where the government controls healthcare. They come from the United States, where the government doesn't.
Is that true? I feel like that's not 100% true. Like, he's basically saying, like, no medical innovations have ever come from any country besides America, basically, or countries that don't control the medical care, which I just don't think is true. I mean, I can Google it. Let me see. Most recent medical breakthroughs. Let's see where they're from. All right, top 10 medical innovations. Let's see. Does it say where this is from, though?
That's what I don't know.
Oh, that one doesn't.
Well, what if you Google,
Let's see, where are medical innovations happening? Let's just see what happens when I Google that.
here I have one. So under one of those, it was mRNA vaccines.
Yeah.
And this technology comes from the laboratory of Pieter Collis, a biochemist at the University of British Columbia in Vancouver, Canada.
Isn't that interesting?
That doesn't sound right with what they just told us.
Yeah, I mean, Canada shouldn't be having any medical innovation.
What about neurotech? Neurotechnology was founded in Vilnius, Lithuania.
Lithuania?
Lithuania.
Yeah, Lithuania, yeah.
Lithuania. Huh. That's odd. I don't know what their system is, but...
Let me see. Lithuania Universal Healthcare. It's a mixed system. So predominantly funded from the National Health Insurance Fund through a compulsory health insurance scheme, supplemented by substantial state contributions on behalf of the economically inactive population amounting to about half of its budget. So it's a mixed, which means that it has private and public in Lithuania. That's what it sounds like.
Okay, I have one more. Okay. CRISPR had to come from America, right? I mean, come on, we had to have something that we did, and like innovation. That's America's strong suit. So CRISPRs were first discovered in archaea and later in bacteria, so where they were, by Francisco Mojica, a scientist at the University of Alicante in Spain. Huh. I don't know Spain's system either, but...
I'm pretty sure they have single-payer health or something like that. Yeah, based on the principles of universality, free access, equity, and fairness of financing. So that's their national health system.
Interesting. So not only...
It covers 99.1% of the population. Sorry, go on.
I was just going to say, interesting. So not only did none of these three innovations come from America, but they also came from systems that utilize at least partially universal health care.
Yeah.
Interesting.
That pesky government.
Oh, boy.
Of biomedical research and development spending in the U.S., over $70 billion in 2012, comes from the private sector. Discovering new medical cures and technology is a profitable business. Thank goodness it is.
Oh,
Those profits drive innovation.
Were you going to say something?
Oh, I just said it's not profitable. Otherwise, they would be coming up with things like these other countries have.
Yeah.
It's better for them to keep people sick, like you said.
Right. It's more profitable when the people are sick. But, as long as rich people are getting their premium health care, who cares, baby?
Yeah.
Away the profits, and you will surely take away the innovation. Single payer, free health care, Medicare for all, they might sound great, but like all visions of utopia, they ultimately produce a lot more harm than good.
Wait, hold up.
I'm Lan Hee Chen, fellow at the Hoover Institution at Stanford.
Freaking A. If it leads to more harm than good, then it's not utopian. Is it?
Well, I think that's his reasoning.
Right. He thinks it's not, but he's saying it's utopian though. He's admitting that.
Well, I think he's saying
Like all visions for utopia.
Oh, I guess, yeah.
You know what I mean?
For all. They might sound great, but like all visions of utopia, they ultimately produce a lot more harm than good.
Like he just phrased it really badly. Like literally.
I think I see what he's basically trying to say. It sound like, you know how we talked
I get
about
what he's trying to say and everything.
Yeah, okay.
I'm just saying, like, you could have phrased that way better because it makes him sound really dumb.
Oh,
I mean, no
yeah.
offense, but you
It's
know,
like
sorry, I had to.
with cults where if it sounds too good to be true, then it probably is. But in this case, it's not.
Right. It's
Medicare for
we
all is
have
not a
data
cult.
that shows that it. You know, we just went over this data and what it shows.
And we have more too.
Oh yeah,
but...
and we have more to come, of course. It sounds like this guy is done, so we're gonna move on to the next video.
Okay.
With this little dude here. Loony left Medicare for all from Fox News.
Okay.
Let's go.
This week, presidential candidate Bernie Sanders announced a new extreme version of his health policy. It would nationalize 1/8 of the US economy in what would be the biggest act of economic centralization in the history of the world. Medicare for all is tonight's loony left.
Oh God, why did they have to make the graphic like this?
That's a segment on their
actual... making him look so petty.
Yeah.
Yes, this is on the literal national Fox News channel. This isn't like some guy on YouTube who just, made a hate video. Like, this is on national news.
Again, those people represent that organization, and the people that they choose to represent their values are...
I just have to be a little critical of the graphic here.
Well, yeah. It's distasteful.
It is. It's just tacky.
Yeah, and it
makes you look like
who don't, they basically don't have any arguments except to call them
right.
the loony left.
Right. They just come up with little nicknames and they think that's good enough.
Yeah, it's...
And the music.
All right, so I just want to look. I know something about this. I was in the UK. I worked in the UK government, the National Health Service, which is a mild version of what Bernie Sanders is proposing here. We tried to reform it. It's too centralized. It's too bureaucratic. We failed. I just want to focus not on the idea, and wouldn't it be? Yes, I'm all for universal coverage. I've said that many times. There are different ways of getting there through the marketplace. This just.
Universal healthcare through the marketplace. How? I don't know how that would work. I'm assuming he's talking about the capitalist marketplace, and I don't think it works like that.
Because
Because who's going to pay for people who can't pay for healthcare then if it's all through the capitalist marketplace and there's no welfare?
Yeah, because that's not universal. If you have to pay to get it, it's not universal.
Exactly.
Universal would be for people if they weren't able to afford health insurance, they would still be covered. That is universal.
Exactly.
So unless he's talking about nobody pays for it and it's free for all,
right?
I guess.
But he's talking about the marketplace, though. So
yeah.
Unless
he's talking about some random nonprofit hospital popping up and giving free healthcare to people.
Oh yeah, just because out of the kindness of their hearts.
Yeah.
Because everybody is super charitable when given the chance. Like, that's why we don't need taxes. We just need charities. Oh, charities, amazing. Yeah, people only donate to charity half the time to get the tax reduction, so.
Yeah.
Think about the operational thing here, right? He published this bill. This is about setting a budget. This is what they literally mean. For every hospital in America, every medical practice is going to have a budget set by the federal government. They're going to be paid on a quarterly basis by the federal government. Every single one. It's insanity.
Why? Isn't that kind of how it works under capitalism, just without the government involved? Like, don't they put in money quarterly anyways into the business, if it's at least if it's a successful business. I guess if they're not turning a profit, then they're probably shut down. But like, hospitals are profit driven, and of course they're going to make profits and reinvest some of those profits into the business quarterly or however often they do it. So I really don't see how it's very different at all, except for who's giving the money. That's really the only difference.
Yeah.
I think we're past insanity at this point with some of the policies that are coming out of the left. I mean, who cares? You don't need your private health insurance. What I'd like to know is, you have Medicare eligible candidates on the Democrat side. Are they on Medicare? No. Because if it's so great, they probably should be, Steve. But more importantly, these elected officials have these Cadillac insurance.
And how do you know they don't have Medicare? Like, you can have more than one insurance policy.
Yeah.
Like, like you can have Medicare and private insurance in America. Like, you don't just have to choose one necessarily. Like, I've had more than one health insurance before. Before I turned 26.
Insurance policies that go on for a lifetime. So instead of Medicare for all, why aren't they campaigning for My Health Care for all? Because they're getting Supreme Health Care. This is getting more and more crazy by the day. We're talking about putting 20 million seniors off of their Advantage program. We're talking about 181 million people losing their private health insurance.
They're still going to have health insurance. And if we construct it properly, it's going to be just as good, if not better, than the private health insurance.
Yeah, and I mean, if people want to keep paying, let them. I don't care. But everyone deserves healthcare.
I mean, I'm even fine with a mixed system as long as there's access for everybody.
Mm-hmm.
Although I prefer a universal system because nobody deserves better healthcare than anyone else based on how much money they make, especially.
True. Yeah.
But I will compromise on this if I need to. If we need to compromise, we need to compromise. But
yeah,
open
to discussions on it. But these aren't discussions because they're not actually talking fact. They're not talking facts. All they're doing is fear mongering and propaganda.
Yeah, of course.
It's not actual facts or discussion about how we can do it effectively.
Right. And it's not like it's a discussion, like a real discussion with people with multiple opinions. All these people have the same opinion that they're expressing. I'm 100% positive that's what this is going to be. Like, I don't think there's anyone that's going to be opposed to it. Maybe I'm wrong, actually, but I doubt it.
Yeah, we'll see. But
yeah, we got another minute left, so we'll see what they say.
Killing over 500,000 jobs and decreasing the amount of income into families. It's insane.
I believe at the core of this, it is furthering the competition of who can give out the most amount of stuff to win the Democrat primary. Yeah. That's what this is really about.
That's right.
Who can...
Oh no, winning over people's votes by being invested in their needs and interests and wants. Like, oh no, what is this, a democracy? Like, let's get rid of that. Isn't that how it's supposed to work? Like, aren't you supposed to be working for the people as a politician? Isn't that the whole point of a democracy?
Yeah, but don't say democracy because they're going to freak out and say we're not in a democracy. We're a democratic republic.
Oh no.
But either way, what you're saying is true. In a democratic republic, the elected officials should be representing the people that voted for them.
Yeah.
So they're going to do things that will get people to vote for them because that's why people vote for them. That's the whole point of voting for someone.
You're not supposed to gain votes through fear mongering and misinformation. Like, that's a terrible way to gain votes.
Yeah, and it's not
gaining votes through helping the people.
And it's not about whatever the other side was owning the libs. How is that a policy? Why are people voting for that? That's not a policy. How does that help you?
Owning the lib policy is like, don't ask, don't tell, and like, don't say gay bill and all that.
None of those help anyone, though.
Right.
They don't even help the people who voted for them.
Right.
In no way does that help you improve your life at all.
Right. Owning the libs isn't going to get you where you need to be in life.
No, it's just interesting politics nowadays. People don't.
Yeah.
they're not done right. I'll say that.
That's for sure.
You can promise the most amount of stuff to win votes. It is so beyond realistic. It's almost not even worthy of even analyzing the policy, similar to the Green New Deal. But unfortunately,
oh no, how convenient. Oh, I can't analyze the policy. It's too ridiculous. Good job, bro. Good job.
Maybe they just don't understand it, and that's
That's
okay.
what I would assume. I mean, it's
Maybe
okay.
they
You can ask
just needed it
somebody for help
explained.
if you need to. Like,
Yeah, that's okay. If you
but
don't
these
understand
people
it,
aren't gonna do that. They're just gonna say, "Oh, it's too stupid. Like, I can't actually analyze it because it's so ridiculous." Like, yeah, okay, sure, that's real nice and convenient for you.
unfortunately, it is deadly serious because it's now gaining traction in the U.S. Senate.
Right.
We're supposed to treat a complete national takeover
It's
of
unbelievable.
something that 108 million people have private health care that have millions of jobs. Of course not. But what is serious, the Democrat Party has no principles. They just want power.
Well, it's
whatever they need
That's
to do to defeat Donald Trump. Think about
Wow, that's some projection if I've ever seen it.
yeah.
Like, I mean, anyone in politics wants power. First of all, that's just what politics literally is about power. But like, there's a difference between using your power to make the world a better place and using your power to make the world a place where you want everyone to be like you, and you don't want any diversity, and you want people to like not exist. You want certain people to just disappear and not exist. Anyways,
the most amount of
Last talk here.
Well, as a Canadian, someone who's born and raised Canadian, I do not want universal health care in any way. It's such a spectacularly bad idea that it's passed the California legislature 3 times, and even Governor Jerry Brown vetoed it, saying there is no way we can afford it. If you can't.
How old is this video? 3 years ago? Yeah, I'm pretty sure they did that now. I'm pretty sure they did that recently.
California did?
Yeah, let me look it up.
Passed universal for their state?
They did something like that. Yeah, first state in the nation to offer universal access to health care. The California Blueprint. Universal access to healthcare coverage regardless of immigration status. Take action to reduce healthcare costs and hold the industry accountable. Rebuild the state's mental and behavioral health systems. I mean,
That's
that all
amazing.
sounds pretty good to me. Oh, reducing the cost of insulin. That's a good one. First state
What is
universal access to healthcare coverage.
Medi-Cal must be their state. So I actually wondered that because I was wondering if, I know in my state it would never pass, but I was wondering if we were to get a state like a state funded coverage on how that would work. Like, what if someone with Medi-Cal coverage goes to Arizona though? That's my one that would have been my one question. Just how does that get addressed?
Yeah.
Like,
Wait,
I'm assuming.
I'm sorry.
So my thought was that like in a state they should, because I mean, getting American universal health insurance seems hard right now, so we can at least start at individual state levels, and that's getting a ballot on your bill. That is it'll be like a state fund, so like Medi-Cal, so it'd be like Meta North Dakota, Meta Arizona, like each state, since we cannot get it passed on a whole nationwide level at this time yet, because people are fighting it, we could do it on state levels to show that it is helpful, and that will help encourage people to want to do it. But my question is so for someone with Medi-Cal, obviously, I guess I don't know all about it, but with what my plan would have been is that anybody who is in that situation, California resident, will never have to pay. They won't pay. They'll just increase the taxes for your residents, and that will pay for your any hospital, anything healthcare related for you. That would pay for it. That would cover it. So my question then is, what if I'm in Arizona and need healthcare? Because obviously, if we have a nationwide,
you have.
but if we Well, that's what I'm saying.
Yeah.
If
Oh,
it's
okay. Got you.
California, if you have the California state funded healthcare, does California just say, Arizona, send me my California residence hospital bill and we will take care of it? That's how I assume it would work. So then
I
you
would
still
hope
have
so.
universal coverage wherever you go in this nation,
But
but
sometimes
your
I
state
don't think
covers it.
I have a feeling they don't do that though.
I think they should. That
They
would be
should
because you're
definitely.
already paying for it. Should, I mean, we should have universal nationwide
Yeah, any
health
healthcare
coverage,
insurance
but
should be nationwide, no matter where you're getting it from.
oh, health insurance doesn't even cover nationwide?
Not all like I know the insurance I was on when I was on my mom's insurance only covered it in one state. In the state.
Then what's the point? How are they saying the system is good?
Although it did cover some stuff where I live now, too.
Well, okay, so what
So
about
but it wasn't like if I was in the ER or something, it wouldn't cover it in another state.
but I'm assuming like for Canadian health coverage, it doesn't matter what province you're in, it covers it, right? Or does it matter
I'm
what
not sure
province you're
about. I
in?
don't know about Canadian health insurance that much. Not
Well,
to
I would hope that if
yeah, that would
you
be ideal. Yes,
were from Ottawa, isn't that a
I
province?
think that's a city.
Oh, well, either way, if you go from one province to another, I would hope that it would cover it with your taxes, because that's the whole point of having a universal healthcare system. Part of the whole point of having a universal healthcare system is you can get coverage wherever you go in that nation where you
I
pay your
mean,
taxes, or state if you
eventually, like it should just be even if you're outside of the country, maybe like you could still get insurance outside of the country if you're like a citizen and you're like visiting there or something. But if you're like living there as a resident, maybe you have to get healthcare with them. But
You mean in another country?
yeah,
Well, yeah. I mean, I guess I didn't assume that our coverage would cover other countries, but
right. But I'm saying that it would be nice if it did.
oh yeah, that would be nice too. I mean, we should just have global healthcare. I don't. People aren't gonna like that word. I
Oh
don't think
no, not
global healthcare.
globalism. Oh no, what are we gonna do about the
Oh
globalism?
no, we're gonna work together as a society. Oh no,
Oh no,
that's
not
crazy.
community and not social, not diversity and social interaction. We don't like any
I
of
think
those things.
the
We're
I
individuals.
think the biggest problem though to actual working together as a global community is the leaders, because the leaders aren't willing to
Yeah,
give up a slight bit of power so that we can all benefit. Every single individual on this planet can benefit. They're not willing to give
right.
up this tiniest sliver of power for that goal. So it's not even, I would say, like voters are average everyday people from every nation. It's literally the
Right.
leaders who crave that fake power
Yeah.
dynamic that they have. It's but yeah, either way, so I guess I wonder, I'm assuming Canada, if you went to, like, if you were
Like if you went
visiting,
from province to like if you went from like Quebec to Ontario,
I'm
like you
assuming you'd be covered, but I guess I'm not gonna claim that without knowing, but we can look later, or
yeah.
someone can correct us if we forget to look or whatever, but
Yeah. All right.
What are you doing here?
Good point.
Okay. Well, if you want more on that topic, watch Deep Dive on Fox Nation. Sign up for Fox Nation if you haven't done that already. We're going to be going into this Medicare for All insanity tomorrow's edition of Deep Dive. All right.
Yeah. So with the California thing though, I think that was more about including immigrants in Medi-Cal, but I'm pretty sure like just about anyone is eligible for Medi-Cal who applies. But I'm not sure. I haven't done that in a while. I think they've improved it though.
yeah, I was like, I
I
guess
mean,
I
I
don't.
can be corrected if I'm wrong. I might be wrong, but that's what I think has happened. I'm not sure though.
I'm not sure on their system either, but I just was saying, in theory,
Yeah,
it would be
in theory,
nice to have even like a state-funded healthcare for all system, because we are having trouble getting a government, like American coverage Medicare for all system. So at least we can start on individual state levels and then go from there in
Yeah.
a way to build it up. Kind of like how some states have legalized psychedelics too. And
Yeah,
then we
or even
can
just
build up to the federal level. Or yeah, marijuana. Yeah. So
Yeah.
it's all about starting small and making it better for everyone
That's the
eventually.
beauty of the United States. honestly. We can slowly build a progression instead of trying to get everyone to agree all at once.
Yeah, because then we will have actual evidence and data based from America that proves that it's a better system. And then we can kind of work on kinks on a smaller level compared to if we went nationally right away too. But
exactly, yeah. So, all right, I have a few graphics here. These are the cost of different things without insurance if you don't have insurance in the United States. So a hysterectomy can be $8,700 to $40,000 plus. Appendectomy, removing your appendix, $1,800 to $82,000 plus. Cataract surgery, $330 to $12,000 plus. Tonsillectomy, $790 to $12,000 plus. Gallbladder removal, $8,000 to $54,000. Coronary artery bypass, $21,500 to $254,000. That's a lot of money.
I'd like to also just point out that a lot of those aren't elective. Appendectomy is like if your appendix bursts, that's a medical emergency.
Right, or like a coronary artery bypass.
Yes, though you can't choose not to get those done.
Right, exactly.
So there's no choice in that matter. So people who are like, well, they could just choose. No, you
Even
can't choose
gallbladder
not to get
removal,
it.
I think.
No, yeah. Or you can choose not to get your gallbladder removed and live. I'm assuming it'd be painful and really bad for your health overall.
And even if it is elective, like you should have the right to make medical decisions for your own body.
Yes. And
Like,
hysterectomies can be medical emergencies too.
Yes.
So any of these, I mean, even probably a tonsillectomy, it depends on what, anything can happen. So, like, it's just annoying that this shouldn't, if we have to get this done to live, we shouldn't be like, it just is crazy to me that it's like,
you can pay.
Yeah, it's either you have money or you die.
Yeah, pretty much. So family planning. It's a little blurry, but prenatal care is $100 to $2,000. Labor and delivery, $2,700 to $40,100. Cesarean section, $10,600 to $50,500. Postpartum checkup, $100 to $3,100. I don't even know what this says. It's really blurry. Let me see if I can look at it. Yeah, no, I can't read it. I can't read that last one, but $3,000. I think that's like when the baby is like right after they're born and they put them in the little incubator thing.
Oh,
I think that's what this is supposed to be. That's what the picture looks like, at least. And that's $3,000 plus per day. Yeah, that's when they're in the NICU.
Oh, which also is not a choice.
Right. And then common tests without insurance. An MRI, $500 to $7,850. A blood test, $40 to $3,000. Cholesterol test, $50 to $130 or $40 to $75 with an at-home kit. And then X-ray is $200 to $3,000. Cancer treatments. Breast cancer, $48,500 to $300,000. Pancreatic cancer, I think, is that $31,000 to $200,000. Looks like brain cancer, I think, $50,000 to $700,000. Oh my gosh, I'm not sure what this one is. I can't read it. It's too tiny. I wish I could read these more.
I wonder if it's or one of those blood cell cancers.
Yeah.
Or like it looks like it's supposed to be a blood cell or immune cell is what
Right. Yeah. What's it called? When you have blood cell cancer, though, what's the name for that?
Isn't it lymphoma?
Is it lymphoma?
Leukemia?
Leukemia. Yes. Leukemia is what I was thinking of.
Lymphoma is the lymph nodes.
I was going to say, yeah, because lymph nodes. Lymphoma, yeah. That's
Yeah.
why I was confused there. Yeah. And then this looks like bone marrow cancer or something. Bone marrow replacement or something. Something with the bone marrow. $638,000 to $900,000. No medical care. Even if I can't read what this is, there is not a single piece of medical care in the world that should cost this much.
No,
Like,
that's
just
more than
greed.
a house.
Yeah, that's more than like a mansion. In some places, at least.
In some places, yeah.
Maybe not in like Brooklyn, New York, but like, you know, in the Midwest or in the South, like a mansion would be $900,000. You could buy like a 6-bedroom house with that kind of money some places. And then, all right, we've got average medications. Insulin for diabetes, $530 to $1,100. I'm assuming that's per month. Cholesterol medication, $30 to $130. Asthma inhalers, $60 to $70. Allergy shots, $600 to $2,000 per year. And then we've got emergency care. Ambulance, $400 to $1,200 plus. Yeah, I've seen way more than that for an ambulance. I've seen like $3,000 for an ambulance before, so just saying. ER visit, $150 to $20,000. That's a big range. Urgent care, $80 to $500. Air ambulance, $2,000 to $200,000. All right, and then so that was all the costs of different things without insurance. This just shows that U.S. hospitals have the highest administrative cost, according to a study of 8 countries. 25% of all U.S. hospital spending consists of administrative costs, including salaries for staff who handle coding and billing. Suspicious. This compares with hospital administrative spending of 20% in the Netherlands, 16% in England, and 12% in Canada. Then my last infographic here is U.S. prices for certain procedures are much higher than in other countries. You can just look at the rest of these prices, but I'm going to list off the U.S. prices. So an appendectomy, $7,962. Normal delivery, $4,451. Cesarean section, $7,449. Coronary angioplasty, $14,378. Coronary artery bypass graft is $34,358. A hip replacement is $17,406, and a knee replacement is $14,946. Australia comes close to us with a couple of them, but other than that, like, it's looking way lower in every other country here than it is in the U.S.
So, and then I just kind of want to go over a couple of articles here too. So I'm going to start with the average cost of health insurance in 2022 in America. So I guess some key takeaways here that we can mention are the average health insurance premium for a 40-year-old is $477 per month. Maryland has the lowest monthly average premium of $338, and West Virginia has the highest at $712, so it depends on where you live. And then also, obviously, family size, plan type, and all that. So I was just going to look at, I wanted to see here, this just kind of shows the average health insurance premiums by state. I guess I can show more. So as you can see, this is your annual cost with I guess I don't know what, then obviously there's different plans too, but I would say this is the typical cost for a good, quote unquote, good plan. And this is going to be your annual cost. And this is all like obviously out of pocket. Like this is what you are paying to have the health insurance. So this doesn't even include if you end up in the hospital, if you have prescription medications. This is just to have the plan. Yep, this is just for the plan. so that you have health insurance. Even so, you're paying this much a year just to be safe, and you're not even really safe, I wouldn't even say, because then there's still a lot of other costs that come with it. So that's just the bare minimum that you will have to pay. This is some of the differences that you could see based on family size. Obviously, as you see, that is going to increase. And then I guess age also can make a difference. And as we get older, it's going to cost more. Which I guess, I mean, that's not right, but.
Right. I agree.
And then I wanted to show, because, this free market that everyone's going on about, let's look at these companies. They got to be, what? Well, why are they all close to the same? What? How is that a free market? Isn't there supposed to be competition for me? Like, shouldn't there be one that's probably like $200 so that they can get more customers compared to these other? Why are they all kind of the same? Is that really a free market?
Well, they do have different plans. And it's just the average. But, like, I get what you're saying, though. Like, the average is still pretty similar.
Yeah, to me, that's still not... I mean, I guess it does depend on their plans. If, let's say, Kaiser offers a lot more benefits than Blue Cross Blue Shield, or vice versa. But that's still... This is, to me, a free market is going to be way... Like, maybe not way more fluctuating, but this is like a joke, in my opinion. If we're going to talk about the reason we want to keep healthcare a paying system like it is for the free market, this is not a free market.
Right. It's pay to play.
But yeah, it's a joke. All these people are benefiting off of our misfortune. And they're keeping costs the same. And I think it's not even truly a free market either, because like you said, it depends. Some of them only cover certain states, so you're still locked down to certain companies that only cover your state, so it's still not a free, so you're still trapped. Yeah. So I was just going to read this here. The average cost of health insurance for job-based and public plans. So job-based insurance, 2021, the Kaiser Family Foundation reported that the total cost of family coverage through employers averaged $22,221, with employees paying $5,969 of that. Individual deductibles averaged $1,669, though employee cost varied by type of plan, family, or individual coverage and size of the company. So then Medicare, the government-run insurance program that covers nearly all Americans 65 and older, also known as Medicare Parts A and B, covers hospital stays and medical care respectively and has set costs. Most people pay no premium for Part A, but do pay a deductible, $1,556 in 2022, and coinsurance, or a share of costs for longer-term facility stays. Part B premiums are $170 per month, though your income can affect this amount, and the 2022 Part B deductible is $233. Once you meet that deductible, you typically pay 20% of the bill for Medicare-approved charges. Some Medicare enrollees choose to get prescription drug coverage, Part D, or join a comprehensive managed care plan that combines all their Medicare benefits. Part C and D are optional, offered by private companies. Costs for these coverages vary by carrier, plan, and geography. Medicare supplement plans, sometimes called Medigap, are another option for people who want more coverage than original Medicare but do not need or want the full scope of coverage in Medicare Advantage. There are several types of Medicare supplement plans, each with defined benefits but with different costs and extra features depending on the insurer. And then Medicaid, government-run program primarily for people with very low incomes. It is jointly funded by the federal government and the states, with each state setting eligibility and other rules. Coverage is free or very low cost for most Medicaid members, but specific requirements vary by state. So then I have another article here just because I was curious since we were talking about it. So Sanders proposes a $23 trillion tax increase, mostly on high-income households and businesses. So this was based on his Medicare for All plan is what he was talking about. And so high income households would pay the most. Highest So TPC found that the highest income 1% of households would pay nearly 2/3 of the non-Medicare for All tax hike proposed by the Democratic presidential hopeful. Those changes would cut their after-tax incomes by an average of nearly 30%. The non-Medicare for All provisions would increase average federal tax rates for those top income households who make $837,000 or more from about 30% to more than 50%. They would raise average federal tax rates by about 1/3 for the highest income 20%, so those making about $170,000 or more, from about 24% to 32%. Sanders would raise payroll taxes and the net investment income tax for high-income households, restore the pre-tax Cuts and Jobs Act's top 35% corporate income tax rate, and repeal its 20% deduction for pass-through business income. He'd also impose an annual wealth tax on individuals and a financial transactions tax. To finance his Medicare for All universal government health insurance program, Sanders proposed several additional tax hikes. These dedicated measures include raising the top individual income tax to 52%, taxing capital gains at ordinary income tax rates, and imposing new taxes on workers and employers to replace health insurance premiums. Sanders also would generate revenue by eliminating many healthcare-related tax preferences, which would become irrelevant in a universal public program. So basically, he would raise... So yeah, you could institute a program like this by just raising taxes on people who could afford to take a little, like pay a little bit more.
Yeah.
Because I don't even know if we were to look up the statistics of people who make 100, I don't think many people even make that much a year. So it really wouldn't, I don't think that's considered middle class. So it's not going to affect the middle class. I don't know what is considered middle class.
Where is this article written though?
I think, well, it must have been when he was running for president. So 3 years ago.
Yeah.
I'll look up what is middle class.
Because I feel like since then the middle class has gone up.
You think it's gone up?
Yeah, like the amount.
Middle income is made up of people who make between $43,350 and $130,000. So
I thought
it is not going to increase taxes on middle class or low income people. So or at least his proposed plan. I mean, somebody could, I guess, but why would you?
Right.
If you can afford to do it with the higher income people. Like what would be the point of raising taxes on the lower incomes?
Yeah.
Because we already have a huge wealth inequality gap in general anyways, which is destroying America. So we need, I mean, not that this would solve that per se, but I mean, this would just be beneficial to provide healthcare to everyone, regardless of if it helps the wealth inequality gap. That isn't a solution. I'm not saying it's a solution to that.
Yeah,
but
although I do think healthcare is part of the income inequality gap. I think they're definitely related.
Yeah, like the barriers to healthcare.
Not only and the barriers to healthcare as well as just the premium access healthcare for the wealthy.
Yeah, like it's a issue with it. Like it's but not a cause. I wouldn't say it's a cause. It's just
I'm not saying it's a cause. I'm just saying it's a related issue.
Yeah, what is that called? I know there's something what I'm trying to think of.
They're correlated, I think.
Yeah. It's just like a part of the system. It's not because of the system and it didn't cause the system. It's just a part of that system.
Yes.
And then this article here, Americans' challenges with healthcare costs. So about half of U.S. adults say they have difficulty affording healthcare costs. About 4 in 10 U.S. adults say they have delayed or gone without medical care in the last year due to cost, with dental services being the most common type of care adults report putting off due to cost. Substantial shares of adults 65 or older report difficulty paying for various aspects of healthcare, especially services not generally covered by Medicare, such as hearing services, dental, and prescription drug costs. The cost of healthcare often prevents people from getting needed care or filling prescriptions. About a quarter of adults say they or a family member in their household have not filled a prescription, cut pills in half, or skipped doses of medicine in the last year because of the cost, with larger shares of those in households with lower income, Black and Hispanic adults and women reporting this. High health care costs disproportionately affect uninsured adults, Black and Hispanic adults, and those with lower incomes. Larger shares of U.S. adults in each of these groups report difficulty affording various types of care and delaying or foregoing medical care due to the cost. Those who are covered by health insurance are not immune to the burden of healthcare costs. About 1/3 of insured adults worry about affording their monthly health insurance premium, and 44% worry about affording their deductible before health insurance kicks in. Healthcare debt is a burden for a large share of Americans. About 4 in 10 adults, 41%, report having debt due to medical or dental bills, including debts owed to credit cards, collections agencies, family and friends, banks, and other lenders to pay for their healthcare costs, with disproportionate shares of Black and Hispanic adults, women, parents, those with low incomes, and uninsured adults saying they have healthcare debt. Affording gasoline and transportation costs is now a top worry for Americans, followed by unexpected medical bills. While worry over gasoline and transportation costs has risen markedly since 2020, significant shares of adults still say they are worried about affording medical costs such as unexpected bills, deductibles, and long-term care services for themselves or a family member. So then I think this just kind of shows, I think it's all of those that I just said, but it shows it in like a graph picture for those who like pictures. So skipped recommended medical treatment due to cost and delaying needed care. Dental services, most likely delayed due to cost. And then this just shows kind of who is having difficulty affording prescription drugs. And this one shows that about 1/4 have not taken a medication as prescribed. Fewer have tried to obtain medications outside of the U.S. or taken donations. 4 in 10 adults currently have debt due to medical or dental bills. Large shares of the public worry about affording various medical costs similar to other household expenses. And about half of adults would be unable to pay for an unexpected $500 medical bill in full, including larger shares of women, those with lower household incomes, Black and Hispanic adults. So I just think that is also, even with our healthcare insurance system that we have now, people still cannot afford healthcare, and it's a big issue for a lot of people. And I mean, that also, I would say, it could be due to just the wage inequality too. But so then I wanted to look here, how does the quality of, because they like to claim that America's healthcare system is the best in the world, but let's look at how it compares to other countries, shall we? So life expectancy, let's see. So the United States is over here. That's good. 77. Yep. I bet COVID probably.
I was gonna just say that. I'm sure that's COVID.
Well, I guess this is 2020.
Yeah.
But
that's when COVID happened.
But I don't think it would have affected it that quick. I mean, I guess the proportion, like, of all the people who passed away due to COVID would affect, like, proportionally. But even then, it was still not good. Comparatively, comparable country average is 82, and we're at 77. And that's
right.
Yeah,
it doesn't look like we've passed 80.
And let's see. This looks good, right? We're going up. All cause age adjusted mortality. We shouldn't show that then. We don't want to see that, actually.
Yeah. Interesting.
And then let's see. What about this one? This has got to be good, right? We're above. We're better.
Potential years of life lost per 100,000 population. So yeah, this is the life loss.
Oh shoot. Well, don't look at that, guys. Just kidding. Don't look at that one. Let's see. This has got to be better. I mean, we're
age,
winning.
Gender, disability adjusted life year. I don't know what that means.
I think this is how many, I guess, let's see. That's disease burden.
Oh, that's the last one.
I think it has something to do, obviously, with disability.
Right.
And I'm assuming age standard. So I feel like it would be you're losing years because of a disability, but I don't know for sure, and I can't really see. Oh, we're here.
Oh, it counts for both premature death and years living with disability.
Okay.
So it's disease burden, basically. So it's not good that we're doing that much.
Then we can't show that one then. Okay. How about this one?
Health quality and access index rating. Oh.
Well, how can they do that? They just had us at the top with bad things, and now they're putting us at the bottom with good things? No, that's fake. Fake news.
Fake news, everybody.
What about this one? Oh, look at, we're winning.
Maternal mortality rate. Oh my God.
Oh, just kidding. Don't look at that. Nobody saw that. What about this one?
Mortality rate per 100 patients after admission to the hospital for acute myocardial infarction, ischemic stroke, and hemorrhage stroke, age 45 and older. So this is the mortality rates for those certain things. And
I mean, I think so age, standardized 30-day mortality. So I feel like it seems better, right?
Yeah.
Like we have a lower number, like our 30-day mortality. But I also know, working in healthcare, that is something that they pushed. So they don't,
and it's just
I've heard
diseases,
Yeah, and I've heard that they will do everything they can to make you get to 30 days, but once you get to 31 days, they don't care. If you die at the 31-day mark,
because they want it to look good.
Yes, they want this to look good, so they just care about their statistics. So they will do everything in their power to keep you alive for those 30 days, and then after that, you're on your own. And I mean, maybe other countries, but I highly doubt with being universal healthcare, they have that same mentality, because they care about the people as a whole rather than some statistics to make it look like they're doing good, because they actually care about doing good.
And I'm sure that depends on the country. I'm sure some countries still with universal healthcare push for certain averages to look better. But not every country, though. Definitely not every country. Oh, let's see here. This is hospital admission rate for asthma, COPD, diabetes, and congestive heart failure, 15 and over. So asthma looks like we got more. COPD, we have less. Oh, diabetes, we have way more. And the same with congestive heart failure.
It's interesting that COPD is less, though. That's just interesting. I'd be interested as to why, I guess.
Yeah.
What about this? Look, we're
number of inpatient cesarean sections performed.
Oh, yeah, I guess I don't know if
that was a C-section. I'm a C-section baby.
But I don't think C-section, C-section isn't good or bad. I guess it's just.
I mean, it depends on why you need the C-section.
Yeah. But we do more than it looks like.
Yeah, we have more C-sections, which is interesting. I'm not sure what that means, but.
Yeah, I mean, somebody could always make any claim they want based on, they could be like, oh, well, United States is less healthy, that's why they need more C, but there's no, unless we have more information, you can't make a claim with that one, at least.
Like with me, I was just a C-section because I literally just refused to come out of the womb.
Oh.
I was a late baby, so they just did a C-section to pull me out. That's what I was told, at least.
Yeah, that happens too. There's a bunch of different reasons that someone could need a C-section, so.
Oh yeah, and some of them are like medical emergencies, so I'm not trying to discount.
Yes. No, yeah.
But, yeah. Let's see.
What about
obstetric trauma during vaginal delivery with and without instrument? Crude rate per 100,000 vaginal deliveries. Age 15 and older. Oh, God. Oh, so Canada is worse than us, but then everyone else is better. What's going on in Canada? Jeez. Although there's a lot of bad stuff going on in Canada right now, so.
Yeah. And this sounds more like because it's trauma during delivery, so that sounds more like a doctor issue than
that sounds
they need more
like
training, maybe. Yeah. What is this one?
Crude rate per 100,000 hospital discharges, postoperative pulmonary embolism or deep vein thrombosis after hip or knee surgery. So, okay, Australia is doing worse than us, it looks like, but we're doing pretty bad still.
Is Australia universal? I don't know.
I think they have universal healthcare, but their stuff is still really expensive.
And this one,
Is it just discharges for sepsis and abdominal surgery? So
I guess I don't.
Does this mean that everyone else died or what?
That's what I'm wondering.
That's what it sounds
That one
like.
I'm not sure on. I guess does it
That's
say
kind of-
rates
if
of
that is what that means,
postoperative?
that's pretty bad. Yeah, does it say?
Oh, well, maybe this is just the rate. Well, it says discharges, though. I don't know. Because down here, it makes it sound like that this is the rate of people getting sepsis, which that would be good if less people comparatively, but I don't.
This is for the discharges.
Yeah, that. I don't think it says, but.
Interesting.
So, medication treatment errors. Third.
That's not good.
Yeah.
But I
That
guess
looks
it could be worse.
So remember, guys, don't look at all those. Only look at the ones that made us look good, right? Okay, and let's see what this is. Healthcare from a global perspective, higher spending, worse outcomes. So, United States had worse outcomes and spent more, largely because of greater use of medical technology and higher prices compared to other countries. U.S. healthcare system. So let's look at the highlights here. The U.S. spends more on healthcare as a share of the economy, nearly twice as much as the average OECD country, yet has the lowest life expectancy and highest suicide rates among the 11 nations. U.S. has the highest chronic disease burden and an obesity rate that is 2 times higher than the OECD average. Americans had fewer physician visits than peers, which may be related to a low supply of physicians in the U.S. Americans use some expensive technology, such as MRIs and specialized procedures, such as hip replacements, more often than our peers. The U.S. outperforms its peers in terms of preventative measures. It has one of the highest rates of breast cancer screening among women ages 50 to 69 and the second highest rate of flu vaccination. Oh, I don't think this year we did, though. Compared to peer nations, the U.S. has among the highest. Maybe we still did with flu vaccinations. I'd have to look, but the news makes it seem like we are not doing good this year.
Yeah.
Compared to peer nations, the U.S. has among the highest number of hospitalizations from preventable causes and the highest rate of avoidable deaths. So this must be our spending,
yeah.
GDP. Oh, wow. That is. We're doing great.
Good job, everybody.
And this one. So U.S. public spending is similar to other countries. Out-of-pocket and private spending are higher than most.
Yeah.
Okay. Oh, yeah. Wow. If you look at
you look at everyone else.
Private
spending is way lower. Out-of-pocket spending, except for Switzerland, has a lot on it.
Yeah, Switzerland is higher out-of-pocket, but I don't know. That'd be interesting to, figure out, I guess. Lowest life expectancy. Oh, wow. Yeah, we kind of saw that with the other one too, but
yeah,
it's just jarring to see that.
Yes. Suicide
rate.
Wow. To be fair, it's not like super high. Oh, that one is though.
The suicide, yeah.
I mean,
that's still that.
It's still not good that it's that high, but
yeah, chronic disease. We're pretty high there.
Yeah, that's pretty bad.
Obesity. Is that
the average rate is 21%, and what are we at? Go over the
40.
US. 40.
Double.
Yeah. So yeah, literally double. That's great.
And we visit the doctor less frequently, and that partly is due to cost, because preventative care is one of the most helpful things that we need to utilize more, but it's expensive in this system that we have.
Exactly.
And I guess fewer physicians
per 1,000 population, we're doing pretty bad.
Yeah, so definitely encouraging people to become doctors by maybe offering a stimulus or like a payment to them would be a good idea.
Medical school, yeah. If they can get in, they still have to pass the MCAT to do it.
Yeah.
But like if they want to do it, they don't have to worry about the cost. And if they're smart enough, then they can do it.
Yeah.
or like not
And
even
open
just
it
like
up
smart, but smart enough in that field at least is what I mean.
Yeah. And I feel, yeah. I guess I don't school, but
Yeah.
I feel like they should open it up to more people too, though.
Yeah.
But they still have to take the test, and like they still have to have the knowledge, but not a memorization based, and more of
Right.
a like there
It should
should be
more
different
like logic
styles.
based.
Yeah,
On,
like
what you
can
would
they?
logically do in a situation, in a healthcare
Yes.
situation.
And do they know how to find what they need to find if they need to look it up too?
Yeah. Yeah, or like
that's
and
an
then
important.
also how to examine like a patient's symptoms properly.
Yes.
And how to
Yes.
listen to patients properly, pretty much. That should be part of it too.
And they have to like because I don't even think
Because
we
I think
have
that's
that
how
many.
they do it on some like psychiatry tests. If I know this, if I'm thinking of the right thing, like where they'll say like, okay, a patient comes in and they're saying that someday, for the last week they've been feeling, very invincible and very impulsive, and then the week before that they were feeling like giving up and they've lost hope. So what do you think that is? Type thing.
Oh yeah.
Like where they explain their symptoms and then you have to determine what they have.
That's how nursing exams were too, kind of like
Is
that.
it?
Like NCLEX style questions are more
Yeah.
application based than knowledge. I mean, you still have to have at least a baseline knowledge, but and I mean, I didn't like that. The NCLEX didn't feel like prepare me, but that's fine because I passed and I was able to be a nurse, and it's much different than the NCLEX too. But so average hospitalization stay similar to that in Sweden. So I would think if we're spending all this money, we could have people healthier and out of the hospital quicker. But high rate of MRI scans. I guess I don't know why.
New Zealand's not doing any.
Yeah. Interesting.
So hip replacements among older adults. Yeah.
I mean, I guess those aren't really.
Oh, sorry.
It's not like good or bad though. That's just
Well, it just means we need preventative care.
Oh yeah, definitely. I guess yeah.
That's what I read out of it.
But it is good that we're doing good on breast cancer screenings at least.
Yeah.
And supposedly flu vaccinations.
That's good. But flu vaccinations you can get for free, right?
Yes, I think so. I guess don't quote me on that, but
I'm pretty sure at some pharmacies you can get them for free.
I think I want to say
free vaccinations from like CVS and Walgreens before.
I feel like
not for the flu, but
would cover it if it, or maybe not. I don't know. I do think it's free most of the time, though. I do think it's free most of the time, though. Now that you mentioned, that sounds familiar. I don't think I've ever, like when we did a flu shot clinic as nurses, I don't remember asking the patients to pay us money. It wasn't like I'm pretty sure they're free. Because we do free flu clinics to get people to get them because we know it's helpful to prevent.
Right, because it'd be similar to how the COVID vaccine is free.
Yeah. So if anything, that just proves that free healthcare works because it makes people willing to go get the flu because they don't have to pay the flu shot because they don't have to pay for it.
We have the highest rate for 5-year survival rate for breast cancer, but the lowest for cervical cancer. Oh. Interesting.
That is interesting. That's a
And then the highest rates of hospitalization for preventable diseases like diabetes and hypertension. Well, I don't like how they word that because not all diabetes is preventable, but some of it, like type 2.
Well, I think it's more so.
Type 2?
Well, I think it's also more so that you can, with diabetes, if you take care of it well,
then you don't
go get your follow-ups, then you're not going to get hospitalized. That's more so what I think, because foot amputations due to diabetes, not taking care of your diabetes, and
but I'm
getting the neuropathy.
I just think it's complicated because diabetes also messes with your mental health, and that makes it really hard to take care of. So it's you need to figure out how to manage it with the mental health aspect of it as well.
But that's why preventative care and
Exactly.
everything is so important, because then you could go to those appointments and they could have more appointments if they feel like you need them, but you can't right now because hardly anybody could afford that.
Yeah.
But why? How I thought it said, oh, among the highest rates, because I was like, this GER, is that Germany?
Germany, yeah.
Is higher than us, but no. They have health universal, don't they? I thought they did.
I think so. I don't know.
We have the highest rate of avoidable deaths.
It's getting lower, at least, I guess. But
everyone's is getting lower.
Yeah, that is true.
Or wait, no, higher. Oh no, just kidding. I thought that said 2020.
Oh, okay. Let's see.
So, while the United States spends more on healthcare than any other country, we are not achieving comparable performance. We have poor health outcomes, including low life expectancy and high suicide rates, compared to our peer nations. A relatively higher chronic disease burden and incidence of obesity contribute to the problem, but the U.S. healthcare system is also not doing its part. Our analysis shows that the U.S. has the highest rates of avoidable mortality because of people not receiving timely, high-quality care. The findings from this analysis point to key policy implications as well as opportunities to learn from other countries. First, greater attention should be placed on reducing healthcare costs. The U.S. could look to approaches taken by other industrialized nations to contain costs, including budgeting practices and using value-based pricing of new medical technologies. Approaches that aim to lower healthcare prices are likely to have the greatest impact, since previous research has indicated that higher prices are the primary reason why the U.S. spends more on healthcare than any other country. Second, our findings call for addressing risk factors for and better management of chronic conditions. We can start by strengthening access to care and primary care systems. Our findings show that the U.S. has a relatively lower rate of physician visits compared to other nations. This is surprising given U.S. adults' seemingly greater health needs. We do know from previous Commonwealth Fund surveys that adults in the U.S. experience greater affordability barriers to accessing physician visits, tests, and treatments. Increasing access to affordable healthcare and strengthening primary care systems are two of the most important challenges for the U.S. healthcare system. Third, the U.S. should promote incentives to use effective care and disincentives to discourage less effective care. For example, a recent analysis estimated that as much as 1/4 of total healthcare spending in the U.S., between $760 billion and $935 billion annually, is wasteful. Overtreatment or low-value care, medications, tests, treatments, and procedures that provide no or minimal benefit or potential harm accounts for approximately 1/10 of the spending. The U.S. can learn from other countries. For example, our comparably high use of MRI scans and surgeries for hip replacement suggests we should assess when these interventions bring the greatest value. The Global Choosing Wisely campaign promotes conversations around evidence-based care between physicians and their patients to help evaluate which tests and treatments are truly necessary and free from harm.
But how does a study determine that? Like, isn't that between the patient and the doctor?
Yeah, they're just recommending that doctors and patients have these conversations.
Oh, okay.
Basically.
I see.
They're not saying that we should cut them per se, but they're saying that doctors should spend more time with a risk-benefit analysis ratio, is what I'm getting from that, instead of just ordering an MRI, because and I'm not saying doctors necessarily do that, but I would not be surprised if that did happen, tests and procedures getting ordered that aren't fully necessary.
Mm-hmm.
Like, they may be helpful at times, but it's not fully necessary. So it's just making more conscientious decisions in a way, I would say, as a doctor. And then having that conversation with the patients too, and giving them their risk benefit analysis, I guess.
Yeah.
So in sum, the U.S. healthcare system is the most expensive in the world, but Americans continue to live relatively unhealthier and shorter lives than peers in other high-income countries. Efforts to rein in costs, improve affordability and access to needed care, coupled with greater efforts to address risk factors, are required to alleviate the problem.
All right. Well, I didn't have anything else.
Yeah, no, I think that is all I had. It's just healthcare. There's a lot that needs to be addressed with it, and we should be having actual discussions on how to address that rather than this propaganda that some people seem to be spreading. So it's important, I would say, when talking about it, to just know the facts. And we may not know everything, but that is why we can look it up and do a little bit of research to figure it out. But it's important to be having these discussions, because as a country, we are not doing good comparatively with our high costs.
Yes.
But let us know down below what you want us to talk about in future episodes.
You can reach out to us on YouTube, Facebook, Instagram, TikTok, and Twitter, and we do occasional Twitch live streams. So check it out.
Yes, and don't forget to like, subscribe, and turn on notifications so you are notified when we do. Otherwise, we will see everyone next time.